My name is Taha.
Welcome. How can I help you today?
Yesterday I had an acid flood. Yes, a really bad situation of acid flood, and I didn't know how to control it. I was going to die, and no one was in home, and I didn't know what to do.
I'm very sorry. It seems like it's been a terrible experience.
Yes.
Would you like some tissues?
Yes, thank you.
Okay, take your time.
No one was with me in home, but yes, my mom came in and she saw me in that bad, terrible. Yes, I didn't know what to do.
Oh, I'm very sorry. It sounds like it's been a difficult experience
Yes,
for you.
it was.
But we're going to help you today.
Yes.
I'm going to ask you some more questions and examine you and do
Yes.
what we can to really help you.
Okay.
Okay, would you like some water as well?
Yes.
Please take your time, don't worry. Do you want to talk any more about why it was so upsetting for you?
Yes, I thought that I was going to die, and the second time it will happen to me, no one will be home with me, and what I have to do, I don't know, and
I'm sorry. I can understand it can be very worrying if you have an asthma attack and nobody's with you and you wonder what can you do about it. And like you say, the main worry seems to be that you haven't got anybody with you and what will happen.
Yes.
So what we'll do especially is get one of our nurses to talk with you about how to recognise the signs of when the asthma's getting bad and what to do about it. So we'll really try to make a plan so that you know when to come to hospital or when to call for an ambulance in the future. Can I ask you some more questions about how you were yesterday and how the asthma attack came?
Yes. Yesterday I couldn't breathe. I was gasping for oxygen, and I was gasping very much for oxygen, and also I had no breathe. I couldn't breathe, and it was so hard for me.
And what time of day did this happen?
At night, especially at night. Yes.
Okay. And how long was it from when this started till you actually came?
For 2 days, I have a cold and a cough. But at night, yesterday, it was the worst time for me. Yes, I didn't know what I have to do, and it was so hard for me. Yes.
At that time, were you able to talk in sentences?
No, nothing. I couldn't take any breathe or anything. Yes.
And did you hear any wheezing sound? Like
Yes, it was so loud. So I was so afraid and very scary, and
I understand that must have been very difficult.
yes.
Have you had anything like this in the past?
No, at the past I could control it, and it can be. I mean, it could be controlled, and I didn't use the inhaler. Yes, only 3 times a week. Yes, the inhaler. Yes.
So you've used salbutamol usually 3 times a week?
Yes.
Just when you needed it?
Yes, but yesterday when I used it, no.
And there was no effect?
No effect.
How long have you had asthma for?
Since I was 14, that's mean 4 years ago. Yes.
And you haven't had any admissions to hospital because of the asthma before?
No.
Okay, and it's been quite well controlled with your inhaler?
Yes.
With the salbutamol inhaler a few times a week?
Yes.
Okay. And then last night it got really bad. You had difficulty completing sentences, you were wheezing, and obviously very upset and worried about it. And came into the hospital.
Yes.
You mentioned you had some cough and cold symptoms.
Yeah.
Have you coughed anything up? Any sputum or any blood?
Sputum a little, yes, but not blood.
And what colour was the sputum?
I think green or yellow. Yes.
Green.
Yes.
Was it a lot or a little?
No, a little.
Okay. And have you had any shortness of breath or difficulty in breathing before this episode?
No. Yes, I told you it could be controlled, but last night I couldn't, so it was really hard for me.
ask you some more questions about your health in the past and your family's health. Is that okay? So, have you had any other illnesses apart from the asthma?
No.
Have you had any operations in the hospital?
No,
or stays in the hospital?
I didn't go to hospital. Yes.
And in your family, your mum, your dad, brothers, sisters, are they all well, or do they have any diseases or illnesses?
No, they are all well and no diseases. Only me, I have.
You said you took a salbutamol inhaler.
Yeah.
Do you take any other medicines?
No. No.
And are you allergic to anything?
Yes, that's me.
What happens if you take penicillin?
I had to go to emergency, but yes, this happened once for me that I take penicillin, but not yes.
So did you have difficulty in breathing, or just, for example, a rash?
No, difficulty breathing too.
Take penicillin. And then whereabouts do you live at the moment?
I live in Amman.
What sort of house is it?
It's a flat, yeah, but it's really happened to me hard when there's a lot of dust in the air. Yes, especially in the bad weather days. Yes, I can't breathe, or I had to put things on my face so I can't breathe.
And who do you live with?
With my parents, my mother and
And what are you doing at the moment? Are you
I
studying?
study,
What
yes,
do you study?
meds.
Okay. And I have to ask, do you smoke cigarettes?
No, I don't smoke.
Have you ever smoked?
No,
And do you, I'm sorry to ask this question, it's very personal, but do you drink any alcohol?
no,
Or have you ever used any drugs that are illegal that you're not meant to use?
no.
Okay. Have you travelled at all recently?
No, recently no, but in the past yes.
Okay. And do you have any animals or pets around?
No, I have allergy a lot of animals, so I don't. Yes, I don't have.
Okay. So you've told me about this episode that happened, and like you said, you were very upset and worried that you would
Yes,
die.
very much. Yes,
Has the asthma been affecting your life in any other way?
a lot. I can't go out anytime I want. I have only special times that I can go out because of the dust, because of the weather, and I can't go around a lot of people. I have to be alone for myself.
That must be difficult.
Yes, it's a lot of people.
Okay, I'm sorry about that.
Thank you.
So I'm going to now move on to examining you, and then we'll talk about